Hello, today's topic is EC on head and neck region, particular swelling at the neck region. So, head and neck is challenging to any students of the anatomy because of many important structures are small in and difficult to see in the dissection. As a large number of structures are packed into a small space, the relationship to be studied become complex and the time consuming. So head and neck, it is the challenging part. Not only this dissection portion, but also in differential diagnosis. So I would take you more detail and swelling in the neck region. So today's ECG is cover the which are the differential diagnosis for this swelling. So name is given this large number of the structures packed into the small space. Name is given the neck region. So students who try to develop an overall mental pictures rather than the mugging up and detail will find the study of this region most interesting and rewarding. So it is not only this important in during the dissection, you can see it is not mugging up, but you can develop an overall mental pictures by structures of this head and neck. So after you can see very important region of the body, it contains the brain, eyes, ear, nose, mouth, larynx, which help us in speech, trachea, pharynx, esophagus. Like this, all important structures, including the brain, eyes, they are located in head and neck region, endocrine gland, thyroid, parathyroid gland in the neck region, hypophysis cerebri, pineal gland located in the brain or the head region. So these one are the important region for the dissection purpose and you should be remember throughout your life. Another important structures present in neck region, there is large blood vessels, branch of this brachiocephalic trunk. On the right side, there is a right common carotid artery and right subclavian artery. Another directly branch of this arch of aorta are the subclavian artery and the carotid artery. So these both are these vessels arise from this heart or the arch of this aorta and traveling through the neck region and passing through this internal carotid artery. It is the branch of this common carotid artery and it supplies this brain. Another blood vessels are this vertebral artery. It also the second important branch of the subclavian artery and supply the brain. So there is formation of these circles of Willis and these two artery it supply the whole brain. So any complication or blockage of this artery it may lead to this neurological symptom. Now carotid pulse can be compressed against the carotid tubercle of the transverse process of the C6 vertebra about 4 cm above the sternoclavicular joint. So it is important landmark for the palpation of this carotid artery pulsation. So these one are the located in the neck region. So another blood vessels passes through this neck, keep the brain alive by constantly supply it with the blood. Other structures of the vital importance lying in the neck are the spinal cord. So it should be remember the anatomy of this head and neck region. Then and then you can diagnose any abnormality within this region, either swelling, cyst, lump, ulcer like this. So you should remember first the normal anatomy, then and then you can diagnose these structures. So there is a 12th cranial nerve. It arises from this base of this brain and passes through this foramina at the interior of the skulls and supply the different part of this body, like this olfactory, carrying the sensation of the smell, optic, it is for the sight, oculomotor, third, fourth and sixth, it supply this ocular muscles, extraocular muscles, fifth cranial nerve, it the trigeminal nerve, it divide into this ophthalmic, maxillary and mandible division and innervate the sensory supply to the face. Then seventh cranial nerve, this one are the abducent nerve, sixth cranial nerve are the abducent, it also supply this extraocular muscles. Then seventh are the facial, it supply the motor branch to the facial muscles and sensory are the chorda tympani. Eighth cranial nerve are supply the vestibular and cochlear nerve for hearing and balance. Ninth are glossopharyngeal, it supply muscles of this tongue and pharynx. 10th are hypoglossals and accessory nerve. So this one are the important nerves passes from 12 cranial nerve from the base of brain and it supply this head and neck region, different part of this body. So skull consists of this cranium and facial skeleton. Cranium is body container for the brain and foundation for the facial skeleton. The cranium is made up of this number of originally separated bone. These layers of fusion are known as suture. So important part, skull. So it should be remembered normal frontalis, which are the bone located in normal frontalis, which are the bone, which are the structures, normal lateralis, which are the structures or which are the bone and sutures present in norma occipitalis. Now which are the bone and structures located at the norma basalis and interior of this skull and skull cap. So skull cap, it is the cervenia, it covered the brain itself and interior of the skulls, because here there is a several structures passes from this interior of the skulls, including this 12th cranial nerve, olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear, glossopharyngeal, vagus, accessory and hypoglossals. So they all are arise from this, from midbrain, pons and medulla, and it passes through this foramen, including this cribriform plate of this ethmoid bone. There is passes olfactory nerve, optic nerve, passes from optic canal, third, fourth, fifth का ophthalmic division, sixth now passes from supraorbital fistulas. Now oculomotor nerves, it also passes from this supraorbital fistulas. Then sixth abducent, it also passes the supraorbital fistulas. Trochlea, it also passes from supraorbital fistulas. Then trigeminal nerve divided into these three: maxillary, mandible and ophthalmic. So maxillary passes foramen oval, foramen rotundum. Internal acoustic meatus में से pass हो रही है facial nerve and 8 cranial nerve. Then hypoglossals 9, 10, 11 passes from this jugular foramen. So like this, all cranial nerve, it passes through this foramen. This foramen, you should be remember. So which structure passes from which foramen? Then you can remember the mandible, only movable joint, temporomandibular joint. You can taught today's also. So this one are the mandible. You can remember the part of this mandible, which foramen, which gland are related. Here there is a 3 salivary gland is related to this bone: parotid gland, submandibular gland and sublingual. So you can remember this bone, this one smallest bone at the hyoid bone. It lies inferior to the mandible. The only bone with no direct articulation with any other bone. Act as a movable base for the tongue. So this one are the hyoid bone. It has a greater cornu, lesser cornu and body of this mandible. Now you can remember the boundary of this face and boundary of this skull. So facial muscles, its clinical testing and it in nerve supply of this facial muscles. Now you can remember the danger area of the face, infection from face mainly for the upper lip and the nose can go to the cavernous sinus. Third, the ophthalmic vein and the facial vein. So this area, our name is given this danger area. So any infection, it may be spread to the cavernous sinus to brain. So you can remember these structures, anatomical relation of this face, facial muscles, and its clinical importance. Then you can remember the skull in its 5-layer skin, connective tissue, aponeurosis, loose connective tissue, and periosteum. So these all are the 5 layer and its clinical importance of this scalp. You should be remember the covering part of this brain. It has a 3 meninges, dura mater, arachnoid mater, and pia mater. Then you can remember this muscle of this orbit and how eyes move, parotid region, its supply, and which are the relation of this parotid gland. 5 motor branch of this facial nerve arise from this and the parotid duct open into this third molar tooth. So 3 salivary gland, its location and its clinical importance. Then temporal region, its muscles of mastication. Infratemporal region, there is a 4 muscles for this mastication. So you can remember these 4 muscles: medial pterygoid, lateral pterygoid, masseter and temporalis. So these are the muscles in infratemporal fossa and used for the muscles for mastication. Zygomatic arch, maxillary artery and its branches and its relation of the medullary artery. So for the infratemporal region, TM joint, it is compound variety, which are the movement of this temporomandibular joint. Then submandibular fossa, which are the structures related to the submandibular fossa. This one are the carotid triangle. Here there is a common carotid artery and its branches, submandibular fossa and lymph node present within this submandibular fossa. Then several nerves related with this tongue, lingual nerve, ninth cranial nerve. So these one are the relation of this submandibular gland to sublingual gland. So all structures you can remember, do dissection properly. When you can remember the normal anatomy, then and then you can diagnose the abnormal structures. So important part of this neck region. Why it is important? Because major structures are located within this neck. There is anterior triangle, posterior triangle. Below this, inferior below this omohyoid, this small area name is given the careful triangle. Being a surgeon, you can preserve the small structures and important part arise from this brachial plexus, subclavian artery and vertebral artery. It is part of this careful triangle or supraclavicular fossa. This one are this careless triangle of the posterior triangle because there is passes only the muscles and 6 nerve at the nerve point. So it is remembered here there is a cutaneous nerve and spinal part of this accessory nerve. It passed within this medial border of this sternocleidomastoid muscles. Here there is a carotid triangle. Here passes the common carotid artery and its branches, both external and internal carotid artery. Then muscular triangle. This one are the digastric triangle and submental triangle. Then you can remember the anterior part of the neck. This one are the symphysis mentae, chine. Below there is a hyoid bone, thyroid cartilage, cricoid cartilage and thyroid gland. Below there is a trachea. So these one are the midline structures. Laterally there is a common carotid artery. This one are the internal carotid artery and external carotid artery. And here this dilated part name is given the carotid sinus. So first landmark of this neck region you can remember, then you can palpate each and every structures by the lymph node. Normally you cannot palpate any lymph node, either pre-auricular lymph node, parotid lymph node, tonsillar lymph node, submental, submandibular, superficial cervicals, occipital, then deep cervical, posterior cervical, supraclavicular lymph node. These all are the location of this lymph node. You should be remember its position, because any infection or any inflammation there is a increase the lymphatic substance, and lymph node is palpated, it is not a good sign, because either it may be inflammatory or it may be metastatic. Thyroid gland, it is the ductless glands because it is endocrine gland. Sometimes there is a large, at the position of this thyroid gland swelling, there may be thyroid enlargement. So highly vascular ductless gland, unique, manufacture, store and release the hormone, depend on external environment for raw material, and richest compared to the adrenal kidney. So this one are the thyroid gland, are the important structures located midline of this gland. So you can remember any swelling at the midline part. So it should be take the first history of this patient. Why it should important? Because history at the commonest cause of the swelling in the neck is enlarged lymph node or any part of this midline structures, either thyroid gland or any other structures. So it is important to taking the history. Then you can palpate if it is pulsatile swelling or not, because there is a carotid, common carotid artery, internal carotid artery and external carotid artery. Sometimes there is an aneurysm, it may be dilate and there is swelling within the neck region. So you can remember its branches, because any cessation or obstruction of this artery lead to this there is a ischemic necrosis, either in neurological symptom or loss of this blood in upper limb, because subclavian artery, it is continuation of this axillary artery. Now you can remember the back, there is a dip to this trapezius, there is a suboccipital muscles. So suboccipital triangle is important because here there is passes the third part of this vertebral artery, and great occipital now, and these are useful for surgical procedure for the cisterna punctures if there is a contraindication of these lumbar punctures. So these one are the important region of neck region. At the root of this neck, oral cavity, there is location of this nose, nasopharynx, oropharynx, laryngopharynx, anteriorly trachea, posteriorly esophagus. This one are the mouth or the oral cavity. Here there is a present the tonsil, the larynx, hyoid bone, thyroid cartilage, cricoid cartilage, trachea and cartilage. So these all are the important part of this neck region. And last you can remember the ear and its structures, external ear, middle ear and internal ear, its function and its structures. So this one